Welcome to the 2024 Open Enrollment. This presentation will cover important deadlines and information about the many benefits available to you as a state employee. Each year, employees can make new benefit elections or change their benefits during open enrollment. The choices you make lock you into your benefits for the next year, unless you have a qualifying event. More on this in a few minutes. It's worth it to spend some time getting familiar with your options. This year, open enrollment opens Wednesday, October 25th and ends Wednesday, November 15th at noon Eastern Time. During this time, you can use PeopleSoft to enroll in coverage or make changes. Any changes you make in open enrollment are for January 1st, 2024. Before we jump in, we're going to spend a few minutes going over some key terms that are used in insurance and benefits. A lot of this lingo is specific to insurance and not things that we use every day. Understanding these terms will help you to understand the options being offered to you. First, let's discuss premiums. Premium, this is the amount that you pay for insurance. The premiums for the option you select will be deducted from each biweekly check. Allowed amount. This is the discounted rate that is in-network providers have agreed to. Going to in-network providers saves you money. Even when staying in-network, it pays to shop around since some in-network providers have agreed to bigger discounts than other in-network providers. Deductible. All of the health plans have a deductible. This is the amount that you must pay before the health plans start paying for services. Coinsurance. After the deductible is met, the plan starts paying for services. The coinsurance amount shows how much you pay and how much the plan will pay for services. Out-of-pocket max. This is the maximum you will pay for services in the year if you go to an in-network provider. Once you have met your deductible and paid enough in coinsurance to get you to the out-of-pocket max, the plan will pay 100% of the allowed amount for services. Maximum exposure. This is a helpful figure to see how much your health insurance costs when you meet your out-of-pocket max. Your max exposure is the premiums you've paid plus the out-of-pocket max minus any health savings account contributions you have received from the state. Health Savings Account, or HSA, is a special bank account that allows employees and employers to make tax-free contributions. HSAs can only be used with a high deductible health plan and can only be used to pay for medical expenses outlined by the IRS. Eligible dependents are persons that can be enrolled in family benefit options. This includes your spouse, children, stepchildren, foster children, legally adopted children, and children whom you have legal custody of. Children are eligible for coverage until age 26. Disabled children may continue coverage beyond age 26 if they meet the requirements. A qualifying event is a life event that allows you to make changes to your benefits. Some examples are changes in marital status, birth, loss of a dependent, and changes in employment status. Remember, most elections you make at open enrollment cannot be changed unless there is a qualifying event due to federal regulations. We're going to start with a quick overview of what's the same and what's different before getting into the details. First, what's the same? The state will continue to offer three medical plans, CDHP1, CDHP2, and the traditional plan. All three plans will be administered by Anthem. The amount the state puts into an HSA account on your behalf is also staying the same. The in-network providers for the three medical plans will continue to be split into two tiers. Tier 1 is preferred in-network providers with the best prices for hospital services. Tier 2 is all other in-network providers. Now for the changes. Deductible and out-of-pocket maximums for all three health plans have been adjusted to keep pace with the rising healthcare cost while still providing the best benefits to employees. Similar to the bullet above, the medical premiums will be changing this year. The IRS has increased the amount that can be contributed into a health savings account for 2024. The medical flexible spending account limits will be increasing to $3,050. The Tier 1 providers are all part of Anthem Health Sync program. They have agreed to lower hospital costs and are focused on proactively managing patient health. This tier has the best deductible and out of pocket, so the plan starts paying for services sooner. Tier 2 providers are still in network providers and a good option. Out of network providers are the most expensive option. They have not agreed to a visit cost, so there is no limit to what you can be billed. You will still be able to use any providers you want, and you don't have to distinguish a provider during open enrollment. You can use a mix of Tier 1, Tier 2, and out-of-network providers if you like. The same services are covered at all providers, but the price you pay for those services will be different if they are Tier 1 versus Tier 2. It is all about choice and helping you to find the lowest cost provider option. Tier 1 Health Sync includes over 65 hospitals and 2,500 providers throughout the state. Health Sync includes all Ascension, St. Vincent, and Franciscan St. Francis providers. To find a Tier 1 Health Sync provider, log into anthem.com or Anthem Sydney's app and use the Find Cost and Care tool. After searching for providers, click on the Recognitions Tiers link. A box will pop up showing the provider tier and any other recognizations that the provider has. You may need to scroll through the recognitions to find the tier. This is an example of a hospital search where the provider is Tier 1. We'll do the same thing on this provider. Click on the Recognitions Tiers link. This hospital is a Tier 2. We've talked about how the provider's tiers can impact your bill. The place you go for care can also impact what you pay. While we're all familiar with the ER, you may not know that it is 11 times the cost of an urgent care visit. Most primary care offices now have after-hour triage number to help you decide if you need to go to the ER, urgent care, or if you can wait until the office opens the next day. The Anthem Nurse Line provides the same service 24/7. Being choosy about where you go is one more way to save. Next, we're going to talk about the health plans options for 2024. It is important to keep in mind that the only difference in the three health plan options are 1, the premium that you'll pay each paycheck, 2, the deductible, coinsurance, and out-of-pocket maximums. These three things are known as cost sharing. 3, the HSA contribution made by the state. Each health plan option covers the exact same services, has the same prescription drug benefits, has the same wellness program with rewards, and the same provider options. Your big decision is which premium and cost sharing combo is right for you. The three health plan options will look very familiar if you know what we have today. The Consumer Driven Health Plan 1, or CDHP1, is a high deductible health plan with an HSA. The Consumer Driven Health Plan 2, or CDHP2, is the second high deductible with an HSA. The traditional plan, or TRAD, has a traditional deductible and is not HSA eligible. We're going to do a deep dive into CDHP1 since it is the most popular plan. Then we'll circle back to look at CDHP2 and the TRAD plans. This is the snapshot of CDHP1. The deductible, out-of-pocket maximum, and premiums are changing, but the coinsurance rates are staying the same. Like last year, when you go to a Tier 1 Health Sync provider, you'll have the lower deductible, out-of-pocket, and coinsurance rates. No matter which tier the provider is in, the amounts you pay is applied to the deductible and out-of-pocket max for all three tiers. The Tier 1, Tier 2, and the out-of-pocket network, or I'm sorry, the out-of-network are not separate deductibles. I know this could sound confusing, but stick with me. We're going to walk through an example next to show you how it all works. Our example looks at 4 visits. These are the steps we'll walk through with each visit claim and see how the tiers work together. First, we'll look at the service. Next, we'll verify the provider tier and get the estimated cost. Then we'll look at how much has been spent so far in the year. Finally, we'll add up what's due and see where we're at in the deductible and out of pocket for the year. For our example, we're assuming it is the beginning of the year and this is the first visit. This employee needs a specialist visit. The employee was able to find a Tier 1 provider. That's great since the Tier 1 providers have the lower deductible. This visit cost $100. Since the beginning of the year, the employee has not spent anything yet and no deductible has been met. For this visit, the employee will pay $100 towards their deductible. For all these examples, we'll use the buckets on the slide to follow our deductible progress. The $100 paid by the employee applies to both Tier 1 and Tier 2 deductibles. The Tier 1 bucket now shows $100 out of the $3,000 paid. The Tier 2 bucket now shows $100 out of the $3,500 paid. This is called cross-accumulating. Whenever you have a Tier 1 or Tier 2 claim, the amount you pay will always cross-accumulate to both tiers. We're moving on to our next visit of the year. This time it is an urgent care visit. The employee ends up at Tier 2 urgent care and the cost was $215. We're carrying over the amount spent so far from the last slide. That's our $100 for the specialist visit we just went through. No deductible has been met yet. For this visit, the employee will pay $215 towards their deductible. Even though this is a Tier 2 provider, again, everything cross accumulates. So the $215 gets applied to both the Tier 1 and Tier 2 buckets. We're now at Tier 1 bucket showing $315 out of $3,000 paid. Tier 2 bucket showing $315 out of $3,500 paid. The employee's third visit of the year is for a biopsy. The employee is seeing a Tier 1 provider since this is a higher cost outpatient surgery procedure. Using a Tier 1 provider really helps on the visit cost. The visit cost is $3,400. We're carrying forward what we've spent so far on the last two visits, which was $315. No deductible has been met yet, but the visit will meet the Tier 1 deductible. Let's walk through it. Since this is the Tier 1 provider, we start by looking at Tier 1 deductible, which is $3,000. The employee will pay the first $2,685 of the visit to meet the Tier 1 deductible. We found this amount by subtracting the $315 already paid from the $3,000 deductible. Now that Tier 1 deductible is met, the employee is in the coinsurance phase. Coinsurance means the employee pays just 10% of the remaining visit cost. 10% applied to the remaining cost of $71.50. The total paid by the employee for this visit is $2,756.50. Again, everything cross accumulates, so the amount gets applied to both Tier 1 and Tier 2 buckets. You can see the total spent for the year is $3,071.50 in both buckets. The Tier 1 deductible is now met, so all Tier 1 visits will be at the coinsurance until the out-of-pocket max is reached, but the Tier 2 deductible is not met yet. The fourth and final example is for an MRI with a Tier 2 provider for $900. On the previous slide, we saw our spending for the year was at $3,071.50. Since this is a Tier 2 provider, we look at the Tier 2 deductible to see if we have met it yet. It has not been met. The employee will pay the first $428.50 for the visit to meet the Tier 2 deductible. We found this amount by subtracting the $3,071.50 already paid from the $3,500 Tier 2 deductible. Now that the Tier 2 deductible is met, the employee is in the coinsurance phase. The Tier 2 coinsurance is 30%. The employee pays 30% of the remaining visit cost. 30% applied to the remaining visit cost is $141.45. Both deductibles are met. The next visit cost will be based on the provider tier that is chosen. Choosing Tier 1 provider will provide savings on the visit cost. There is a lot of information packed into that example. The key thing to remember is anytime you use a Tier 1 provider, you are saving money through lower hospital cost and better cost sharing. If you'd like to review the example again, you can join one of our upcoming online webinars or find a recording of this presentation on our website. This is also a great way to share this information with spouses or adult dependents who are on your insurance. The example was assuming CDHP1 single coverage. Here's a look at CDHP2. Remember, CDHP2 deductibles, out-of-pocket maximums, and premiums are changing for 2024. It is important to note that the state contributions to the HSA is staying the same. Tier 1 HealthSync has the lower deductible, out-of-pocket, and coinsurance rates. Again, no matter which tier the provider is in, the amount you pay is applied to the deductible and the out-of-pocket max of all three tiers. And here's the third and final option, the traditional plan. Again, deductibles, out-of-pocket max, and the premiums are changing. Tier 1 HealthSync has the lower deductible, out-of-pocket, and the coinsurance rates. All three plans have the same prescription drug coverage. All in-network pharmacies are Tier 1 providers. The cost-sharing rates in the table start once the Tier 1 deductible is met. Before the Tier 1 deductible is met, you pay 100% of the prescription cost. Prescription cost sharing is a little different than the medical side since it isn't a straight percentage. Once you calculate the percentage, there is also a minimum and maximum. You'll calculate the percentage and then look at the minimum and the maximum to adjust the amounts. Remember, the percentage and the minimum maximum do not kick in until that deductible is met. Preventative care services are special. All three plans cover preventative services at no cost to you when receiving services at an in-network provider. This means that the plan covers the cost regardless if you have met your deductible or not. Preventative care services are defined by the federal government. Some examples are your annual physical, immunizations such as the flu vaccine and COVID-19 vaccine, and some medications like tobacco cessation products. These are all services to help prevent diseases and catch problems early on. We talked a little about health savings account when we were going through the insurance lingo. The most important thing to remember is you can only have a health savings account if you have only high deductible health plan coverage. CDHP1 and CDHP2 are high deductible health plans. The traditional plan is not a high deductible health plan. This also means you can't have a non-high deductible health plan coverage outside of your state employee coverage, such as Medicare. The state contributes into the HSA for CDHP1 and CDHP2 enrollees. Half of this money is deposited with the first payroll in January. The second half is deposited over the next 25 payrolls. You can also contribute through payroll deductions. This is a great way to make sure you have money set aside for medical costs, and it's pre-tax. Any funds in the HSA must be used for qualified medical expenses for yourself, your spouse, or your dependent children. It's important to note that the IRS regulates HSA accounts, and there are penalties if you use the funds for anything other than qualified medical expenses. Now that we've been through the three health plan options and talked about some of the great services included in your medical package, we'll spend a few minutes comparing the plans to each other. Remember, the only thing that's different with the plans is the premiums you pay, the HSA you receive, and the cost sharing, which is your deductible or out-of-pocket maximum and coinsurance rates. The CDHP1 has the lowest annual premium and gives you the highest HSA, but it also has the highest deductible. This might be a good plan for you if you are unlikely to hit your out-of-pocket max, and it's still a good option even if you end up hitting it. The CDHP2 has a premiums that is a little higher than the CDHP1, but the deductible and out-of-pocket max are lower. This might be a good plan for you if you tend to reach your deductible or out-of-pocket max. The traditional plan has the highest premiums and no HSA. The deductible is lower, but you are paying for a lot more out of your check each time for this coverage. This might be the right plan for you if you are more comfortable with a lower deductible. Let's look at a chart that puts all these numbers together for you. There are a lot of numbers on this chart, but it's a helpful summary. The top chart shows the amounts for single coverage. The bottom chart shows the amounts for family coverage. This chart shows you the total you would spend in health insurance and medical expenses if you reach the out-of-pocket maximum. It is the worst case scenario and is called your maximum exposure. It looks at a total premiums you pay plus the total medical expenses you would pay minus the HSA you receive. You can see that CDHP2 has the lowest maximum exposure when the out-of-pocket max is reached. You can also see that CDHP1 premiums are significantly lower and the TRAD plan has are much higher. This information is published on our website to refer to. The premiums in the chart on the previous page were for an employee that has accepted the non-tobacco use agreement. Each year, you can elect to commit to being tobacco-free for a discount of $35 on each biweekly premium. When you select this option, you are agreeing to remain tobacco-free for all of 2024, including vaping and e-cigarette products. Employees that select this discount may be randomly selected for testing. If you select this option and feel you can no longer keep your commitment, you can rescind the agreement. But it must be done before you have used tobacco products, and you have to repay any discount that has already been received that year. The dental plan is remaining the same for 2024, including the premiums. This plan works similarly to the medical plan. The coinsurance rates at the bottom of the table kick in once the deductible is met. The exception is preventative care, which is no cost to you. Dental has an annual maximum that the plan will pay. Once the maximum is met, you pay 100% of the visit cost. There are no changes to the vision plan this year, including premiums. This plan is a little different. Instead of a deductible and coinsurance, this plan works on copays and allowances. An allowance is the maximum the plan will pay for a service. For example, if you choose to get eyeglasses, the plan will pay up to $150 for your frames. If you select frames that are $125, the plan would pay the full cost. If you select frames that are at $175, the plan would pay $150 and you would be responsible for the $25, the amount above the maximum allowance. Also, please note that you can use either the eyeglasses or contact lenses benefits in a year. You cannot use both. Maximize your allowances by visiting in-network providers. You can also enroll in or change your life insurance elections. New coverage selected at open enrollment may require evidence of insurability prior to becoming effective. Basic term life, including accidental death and dismemberment, covers 1.5 times your annual salary. The state helps pay some of the cost of the coverage. The cost is less than 10 cents per $1,000 of your salary each biweekly paycheck. You must elect basic term life and AD&D to be able to elect the additional coverage options. The additional coverage options allow you to increase your coverage and add coverage to your spouse and children. New this year, employees may increase their current supplemental life coverage without going through evidence of insurability. If already enrolled in supplemental life insurance, you may increase your coverage up to 4 increments of $10,000, not to exceed $200,000. To be eligible, you must actively be working. In addition to increasing supplemental life, you may also waive or decrease any of your life plans or enroll in or increase your child and voluntary life without evidence of insurability, as long as you are enrolled in basic life. Certain elections require evidence of insurability, such as enrolling in basic, supplemental, or spouse life for the first time, increase in spouse life or supplemental life over the 200,000 limit. Another great benefit that helps you save money is the flexible spending accounts. This account allows you to make pre-tax contributions and must be elected each year. Your elections do not roll over from year to year. Make sure you've spent some time deciding the right amount to contribute since these accounts are a use it or lose it. If you do not have enough expenses incurred to get reimbursed for all funds contributed, you'll lose those contributions. The state is paying 100% of the cost of administering this benefit in 2024. There is no cost to you other than the contributions you choose to make. Your flexible spending account options are Health FSA. This is for individuals that do not have an HSA. The funds you contribute can be used to pay for qualified healthcare expenses that are not paid for your insurance plan. This would be things like visits costs you pay before you have met your deductible. The contribution limit will increase to $3,050 for 2024. The limited purpose FSC is for individuals with an HSA. The funds you contribute have some restrictions before you've met a minimum amount of paid expenses. This is set by the IRS annually. Before this limit, you can only use the funds for dental, vision, and preventative care. After the limit, it works like a health FSA, and the funds can be used for any qualified healthcare expenses that are not already being paid by the plan. The limit this year is $1,600 for single and $3,200 for family. The Dependent Care FSA is for individuals with dependents under the age of 13 that would have that will have dependent care expenses such as daycare or before and after school care. This does not include medical expenses. One more way to save is the commuter benefit reimbursement account. If you have work-related commuting expenses such as bus, train, ferry, rail, or van pool, you can contribute up to $280 pre-tax each month to be reimbursed for those expenses. This election carries over from year to year, so be sure to make any desired changes, including waiving coverage while making your open enrollment elections in PeopleSoft. And the last benefit we'll talk about today is the Employee Assistance Program. This is a really great benefit. You're automatically enrolled and the state pays 100% of the cost. EAP is available to all full-time employees plus anyone living in your household. EAP is here to help with life events and stressors. You can receive 8 free counseling sessions and also have access to resources and referrals for legal, financial, childcare, and stress. You can use EAP right now by calling Optum to access services. That's a wrap for the presentation, but we're just getting started in sharing information with you. We'll have dedicated web page and everything you need to know to make the right open enrollment elections for you. You'll You'll also be receiving weekly emails highlighting the different benefits and providing an in-depth information. If you have questions, we're here to help. You can reach SPD Benefits through our email inbox or give us a call Monday through Friday from 7:30 a.m. to 5 p.m. Eastern Time. The closer we get to open enrollment deadline, the busier the hotline gets, so call early.